CJ on the beat.
हेलो हेलो एवरीवन। ये बहुत दिनों बाद आ रहा है नेक्स्ट एपिसोड लेकिन बीच में थोड़ा गैप हो गया था, लेकिन लकीली अभी एक गेस्ट मुझे मिल गई है। हाँ, आज हम लोग मेंटल हेल्थ के बारे में बात करने वाले हैं, और मेंटल हेल्थ में और अलग अलग चीज़ें हैं, उसके बारे में बात करने वाले हैं। तो आज उसी से रिलेटेड ऑब्वियसली हमारी गेस्ट आई है। I'll let her introduce herself.
Hi everyone. My name is Lakshmi. I'm a counseling psychologist. I've been practicing since over a decade now, and I work mostly with adults, both in the clinical mental health and with clinical mental disorders and common mental disorders. So, of course, during the course of our conversation, if there is time, then I can also help you understand what is the difference between these two. But yeah, this is pretty much about myself.
Yeah. So, starting off, if we are talking about psychology and mental health, we should be able to define what it is. So, what is psychology? There's a lot of terms we have heard in this area. So, there's psychology, psychiatry, there's therapy, there's counseling, and all kinds of things. So, what is the difference? Are these overlapping, or they are completely distinct? What is going on?
Okay. Yeah, thank you so much for asking that question. I generally find a lot of people are pretty confused about the difference between psychiatrists, who is a psychologist, or who is a psychotherapist, and the different terms that we use to identify as different mental health professionals. So let's start with psychiatrist. A psychiatrist is a qualified doctor. They are the only ones who can prescribe medications. They're also trained in understanding, of course, the neurological or any pathological disorders connected to the mind or connected to the brain, essentially. Yeah. So that's about psychiatrists. They may not be a trained counselors. Yeah. So all they typically do is diagnose various mental health disorders and write medications for you. The next in the category is psychologists. Now, they are all of these psychologists are masters. They may have done their masters in psychology in various streams. Essentially, a psychologist is either trained in counseling psychologist or clinical psychology, and they can diagnose all mental health disorders. Yeah. So we have a manual, we call it as DSM, which is a diagnostic and statistic manual for mental health disorders. So psychologists are trained in diagnosing all of these mental health disorders. So that's the difference here. Can they do counseling? Well, yes. Most of the counseling psychologists are also trained in counseling. So they also do therapy along with the diagnosis of the mental health disorders. Yeah.
Okay.
The third is the psychotherapist.
Just hold on for a second. You said that counseling psychologists can counsel. Clinical psychologists can't.
No, even clinical psychologists can. Yeah. So the difference here is, the difference here is the clinical psychologists are essentially trained in clinical disorders. So remember, I told you about common mental disorders and clinical mental disorders. Common mental disorders are typically found, most people, when they say they are depressed, they have anxiety or they have OCD or PTSDs, right? All of these disorders are called common mental disorders. The major difference here is all of these can be treated without any medical intervention. Right? So you don't have to visit a psychiatrist to get yourself medications. Yeah, typically that's what common mental disorders are. Having said that, there are instances where you do have to visit. But as I said, psychology is something which is not absolute. What is the clinical mental disorders? These are all disorders which are prolonged. They have prolonged history. For example, bipolar, schizophrenia, multiple personality disorders, psychosis. All of these definitely require psychiatrist assistance, as some of them also require rehabilitation and rehabilitation as well. And that's the key difference between common and the clinical disorders. Yeah. So coming back to clinical psychologists, typically clinical psychologists are also masters in clinical psychology by qualification, and they typically treat or work with patients who have clinical disorders like schizophrenia, bipolar, multiple personality disorders, personality issues, psychosis, major depression, all of these. Yeah. The last in the category is called the psychotherapist. Now, well, again, all of these, whether it's counseling, a clinical psychologist, or a psychotherapist, all of these by qualification would have done masters in psychology in various streams. So a psychotherapist could have done counseling or clinical psychology by qualification. It's just that the model that we use for the treatment or for counseling is a bit different. Yeah, psychotherapists work with clients for a longer period of time.
Okay.
So that's pretty much the difference. It's just the modality we use to connect with our patients and design the plan, the treatment plan for the patients. Yeah, that's pretty much the difference here is.
Yeah. So So the difference, let's say, if I want to keep it simple, the psychiatrist can prescribe medicine and the psychologist cannot.
Yes.
Yeah. So,
that's pretty much the difference here is.
Yeah. So is it black and white? Is it that only medication can cure certain things, or is it that only therapy can cure certain things, or do we need both in all cases?
Well, as I said, with common mental disorders like depression, anxiety, or insecurities, or low self-esteem, or loneliness, rejection, all of these definitely impact the well-being of an individual, right? And therefore, all of these are the reasons why individuals or people reach out to the therapist. Now, these issues do not really require medications. However, when a person goes through a clinical disorder, for example, a major depressive disorder or an generalized anxiety disorder, all of these require medications and psychiatric assistance for sure. Yeah.
But they also need counseling, right?
Yes, true. They definitely need therapy. So if you look at all psychiatric treatment, they are, it's more like a holistic approach where there is medical intervention along with the therapeutic approach as well. Yeah, so both of them go hand in hand.
Yeah. So, as you were talking about this, what I was thinking of is the movie Joker. So, what happens in it is, like, there's, I'm not going to spoil the story or anything. There are some mental disorders which you mentioned, like he has a disorder where he laughs, he uncontrollably laughs in situations that make him tense, and these tend to be social situations where he gets nervous. So and this so what I'm getting at is when at the nature versus nurture debate. So is that just a biological disorder that makes him laugh, or later on we find out something has happened in his childhood, which then makes sense? Yeah, this is why it happens. So what was it? Was it this or was it that? Because the way I see it, the way I have understood it, when you prescribe medication, it's for it's for a chemical imbalance. It's for it's like any other physical disorder. But versus when it's just talk therapy, then it's because of your environment or your upbringing or your childhood trauma or whatever. So how do we determine what is causing what? How much is nature contributing, and where is nature contributing, and where is nurture contributing?
Right. Yeah. Yeah. Well, a lot of us have this question in our mind that where is it really coming from? Where is the origin of any mental health condition in an individual? Now, of course, because you used the example of the movie Joker, so I'm going to give my understanding of the film. I see that the protagonist in the movie had bipolar disorder.
Yeah.
Okay, which is a clinical condition, and hence he did require a psychiatric medication or psychiatric assistance for that matter. Coming back to your nature versus nurture, it's an interesting question because there is a myth that all of us, that most of them who do not, of course, have understanding of psychology and mental health, typically believe that every mental health condition should have a trigger. It must be coming from somewhere. मतलब कहीं ना कहीं से कुछ हुआ होगा उसके लाइफ में जिसके वजह से उसको ये प्रॉब्लम है. Right? Well, it is a myth. It is not true. Okay. So I'm going to quote here a book. The title of the book is called The How of Happiness. Right. So this is written by the psychologist Dr. Sonia Lyubomirsky. Okay. I'm sorry about that, but I every single time get the last name wrong. Anyways, but coming back to the book, The How of Happiness. Right. So let me start there. So the book, The How of Happiness, has there's a research which is published in the book and which talks about the subjective well-being of an individual or of a person. Now, what do we mean by subjective well-being? Of course, I'm not going to throw jargons, but just to simply put it, subjective well-being is a term, scientific term that we use to call happiness.
Okay.
Yeah. So it says that what is your happiness really based upon? So it shows a research where it says that your 50% of your subjective well-being or your happiness is based on your genes or genetic makeup, which means that the nature. Yeah. So what you get from your parents, from both the father and the mother, and so on and so forth. Yeah. 10% of your subjective well-being or happiness is based upon the external factors or the various factors in your life. Yeah. Which means 60% of your subjective well-being is totally out of your control. You can't really control your happiness. Yeah. All is left with you is the 40%, and that is really coming from how do you really respond to adversities, stress, problems in your life. Yeah. So that's where the nurture quotient really kicks in. That how has been your conditioning? In what environment have you been brought up? What's been your values, the belief systems, the mindset, the attitude that has been, kind of shaped up either through your child or through a developmental age, and things like that. So that's where the nature versus the nurture, distinction really happen. The distinction really can be made. Now, there's one, but however, I just want to add one thing from my experience. A lot of disorders, mental health, clinical disorders, essentially, are passed on to us genetically. For example, if my parents had anxiety, I do see in my experience that even children, so at least one of their children, would have the same tendencies. If not the clinical disorder, but at least the tendencies of being anxious, being, having this tendency to overthink or ruminate and all of that. So yeah, there is definitely nature versus nurture. But yeah.
Okay. So Now it gets more and more. I don't want to say confusing. The line gets blurrier and blurrier because, like you said,
Yes.
the parents have if they have clinical disorders, they are going to pass on those
Mm-hmm.
clinical disorders to their children. And because they have clinical disorders, they are not providing a conducive environment to their child. So वो nature nurture दोनों affect मतलब it's not like just वो genes pass हो गया. The way the parents are behaving with the children, that is nurture, and
Yes.
they're passing down their nature as well as their own nurture to their parents, to their children.
Well,
uh, and that's
right.
happening with one
Yeah, yeah.
individual. That's happening with one
Mm-hmm.
individual. How do you distinguish that?
No, I think in fact, when I work with some adults, and when they have these children issues, I'm sorry for my French, but I'm going to use the word. The most screw ups that all of us have in our lives is because of our parenting. The way parents really deal with their children, a lot of ups are because of that. And so yeah, you are right, that could be just a double whammy when either of the parent have a clinical condition plus the way they are parenting. So yes, it could be double whammy on some individuals, but yeah, that's the way
But
it is.
we don't like to blame our parents, or we are shamed when we blame our parents.
Well, yeah. I mean, if you really look at it from an Indian cultural context,
Yeah.
we are trained or we are taught not to blame our parents. But that's the truth, right? You can't take away from that your parents really did screw up with your life to an extent. But yeah.
What I wanted to ask you more about is about the accessibility of mental health. I want to know the correct term. Is it mental health care, or like, because healthcare is generally physical health care, so I am
Yeah.
assuming that it should be called mental health care. But is it mental health care, or is there what is the correct term here for getting care for your mental disorders?
I think I mean, as I said, there is. I wouldn't really mind if it is called just mental health or mental health care. I mean, but just as a term, mental health in itself is encompassing of everything for that matter. So I would still want to stick to the word mental health for that
Because
matter.
what I'm thinking is
But
health.
yeah,
Yeah, health is like a noun. Health is a thing. It's a condition.
yeah.
Healthcare is an
Hmm.
action. So, I'm
Hmm.
getting very into the details of it. Let's forget that. What I
No, but I would look at it this way, whether irrespective whether you call it mental health or mental health care,
yeah. Because
it
I'm
doesn't
thinking
really
of
make much of a
healthcare
difference.
center. If there are healthcare centers for physical
Yeah.
ailments, there should be mental health care center as a. That's what
Sure.
I
Yeah,
have in
yeah,
my mind when
sure.
I say that.
Yeah,
So
sure.
yeah. So getting back to the actual question that I wanted to ask you, the
Yeah.
accessibility of mental health care. Who I think everyone needs health
Mhm.
care, mental health care,
Yeah, yeah,
to
yeah,
some or the other
yeah.
extent. But
Right.
do we, or should we make a distinction who needs it more and who needs it less? And if we are allowed to ask that question, that's a different thing. But we are definitely allowed to ask the
Yeah.
question who is uh, easily accessing mental health care and who is not. Who can and who cannot.
Yeah. Right. Right. Yeah. 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 It's interesting, isn't it? Because uh, all this while we were thinking that healthcare is I mean, if you really look at the regular healthcare, and I'm very conscious when I'm saying the regular healthcare, because we have a clear distinction in the mind of physical and the mental, right?
Yeah.
So all this while, we've been always thinking that healthcare should be a basic right to everyone, but we've never included mental health overall in the healthcare, right? And unfortunately, mental health is also political. The reason being that the access to mental health care including mental health professionals and the mental health rehabilitation centers, all of that, right? The accessibility really depends upon a lot of other factors, including your social, your economical, political space. All of these three spaces really have an impact on whether you get the accessibility or no. Yeah. One of the major reasons is because the lack of mental health professionals, so to say, in India. I'm going to quote in some statistics here, which is of course not very recent, but sometime around 2017 or 18. It said that there is one mental health professional, one psychiatrist available for every 70,000 patients in India. You know, that's the huge vacuum and the void that we're really talking about. So imagine if there is no enough mental health doctors or psychiatrists available. Two, because also even the ones who are who get into medical into medicine as qualification don't really take up psychiatry. Yeah. In fact, I'm not really sure, but this is what I heard last time when I was on one of the webinars, which said that just about even in the medical qualification, in the 4 years qualification, there's only 1 week which is dedicated to psychiatry. You see how even there in the qualification itself, mental health is almost discriminated. There's not much of focus given to the mental health space there, and that's why I say that it's all political, social, economical. Yeah. Coming back to this social
I have heard psychology and psychiatry being called soft sciences, and I have used that term for psychology before myself. I've called it a soft science in comparison to hard science. This is real science, and this is not fake science, but it falls short somehow.
Well, that's exactly what we really need to change, right? I mean, yes, we really need to change that simply because psychology is not an absolute science, right? The way the researches are conducted in psychiatry and in psychology is totally different than that. But having said that, we need to change the way we really look at psychiatry and psychology for that matter. Yeah. Especially at this time when India especially is definitely sitting on a mental health epidemic and almost like a ticking time bomb. We really don't know when it's going to really.
I think we can say that about the world right now.
Yes, for sure. And I'm just deducing the whole mental health landscape to specific, and keeping it to India. You know, yes, we as a world also, we are in a crisis, a mental health crisis, more so in India. I mean, the reasons are well known, but yeah. So I was talking about the social access, the social factor when it comes to accessibility. Well, yes, individuals or people who really need it, who are almost at the marginalized in the marginalized spaces when we talk about both economical and social. And when I say economical, yes, individuals who are poor and poor families who are below the poverty line, who live in ghettos and those areas. Also, other marginalizations like the queer community. Right, women from the red light areas, all of these marginalized groups, and of course economic reasons, both have an impact on the accessibility for mental health care. So yes, there is an issue. So who is really accessing mental health care? Urban individual people living in the urban spaces definitely have better access. I may not say that they have 100% access, but at least have better access to it. Also, the way mental health care is delivered these days is also changing, right? Maybe because we are using digital platforms to serve or deliver mental health care now. In a way, it is good because more and more people are able to access that, but it is also furthering the gap. You see, so the individuals who are marginalized, who do not have economical resources, how do they then access mental health care? Yeah.
Yeah. So the economic factor, that's different, and the social factor is different. The social factor comes because there is stigma. There's either stigma surrounding mental health itself, or stigma surrounding the social identity of the individual. So,
Yes.
like if it's a homosexual or a transgender person or a queer person,
Yes.
or the it's a double whammy. Again, the stigma is with the mental health care itself, and the stigma is with the identity of the individual also.
Well, I mean, yeah, I mean, you're right. You're totally right on that. Uh, um, social as mental health as a subject, or as a mental health as a subject itself is extremely stigmatized. We look at mental health as a taboo. At least at least 5 years in the past, it's at least since last 5 years, we started having mental health conversations in the drawing room, or have got these conversations into the mainstream. Otherwise, we always saw mental health as taboo. I mean, in fact, it's still true in many parts of the country. It's more. Having said that, there is more and more awareness which is seeping in, and people are really talking about it. Having said that, we still have a long, really, really long way to go. So it is stigmatized. People always associated or have these negative connotations associated with mental health. For example, ये पागल है. और अगर इसको दवाई देंगे, मतलब जो साइकेट्रिस्ट के पास जाते हैं उसको दवाई देंगे तो मतलब जिंदगी भर दवाई खानी होती है. Myths like psychiatric medications are addictive in nature, right? और जो साइकेट्रिस्ट के पास जाते हैं उनका कोई फ्यूचर ही नहीं है, वो रेगुलर डे टू डे लाइफ नहीं जी सकते. So all of these ideas, wrong notions and ideas and biases are associated with mental health. That's why it is stigmatized. For example, think about all those. You had these. Your parents and your elderly grandmas, all of them spoke about these. This person is possessed when they had these maniac episodes, right? All of this will talk about.
My people I know still describe it as that.
Yes. मतलब और in Maharashtra it's called what देवी आई है, इनके बॉडी में देवी आई है. And as a kid, I would when I've seen these people, and then my mom would say that उनके आंग में इनके बॉडी में देवी आई है. So it would be so funny, to think that how a person could say like that. But that's the way Indian mindset really works, right? So an individual going through a maniac or a psychosis, a maniac episode would be seen as as someone who should be kept away from interactions, or should be ostracized in a way, right? और उनके साथ कुछ गलत है, कुछ तो उनका दिमाग खराब है, something like that. So we've had these ideas connected to mental health, and therefore the social stigma around it. Versus taking the other extreme, not extreme, but other aspect of the continuum would be individuals with varied identities, including whether it is a woman or a man or a queer or other genders, right? All of these genders, when they have to access mental health care, right? So let's say if a person identifies themselves as lesbian or gay or bisexual or transsexual, trans person, all of these individuals have different lived experiences, and their challenges completely different than a binary who's a man or who identifies as a man or a woman. All of these genders will have absolutely totally different lived experiences and challenges, and that needs a different kind of approach. So already they are marginalized and they are discriminated in the society. Plus, if they have mental health, and as you said, it's a double whammy. These are all complex layers, challenge layers upon individuals to be able to access, and which causes hindrances to access mental health care. Yeah. Like I remember uh, just very recently how there was news that a lesbian identified lesbian identified woman was taken by their parents to a doctor who wanted to and of course with the consent of the parent they wanted to do a conversion therapy like the electric treatment on the woman so that she would change her sexuality.
This was in India?
This was, it was a very recent one in somewhere in Goa. There are
I have had this
number of
notion
examples that can
conversion therapy being a Western thing. Because like
oh no, yeah.
But I didn't know that it was it happened in India also.
It very well has been a part of Indian therapeutic approaches for sure. Yeah.
Yeah. So
I also remember Sign Hospital had this treatment also available. I'm not really sure if they still continue to do that, but not as a conversion therapy, but they've had this treatment.
Yeah. So what I was saying was when you said conversion therapy, I was thinking of what I have seen and heard about what happens in the West in terms of conversion therapy, which is there's camps or there's groups and there are it's associated with churches and these ex homosexuals who have converted who believe you can't convert homosexual from a homosexual to a heterosexual. So so generally it's these people who have been through the system and they have been told that you are straight now, and these people are running this these groups and these are the mentors. That's what I had in mind when you said conversion therapy. I never thought electric shock therapy would be used for.
Yeah, no, it is called as it's the electric shock therapy. It's electroconvulsive therapy, which is used to change change one's sexuality. Okay, although there is absolutely not empirical evidences to prove that an individual sexuality is changed. However, of course, these are all deeply rooted into our patriarchal, religio-patriarchal systems, right? Mm-hmm. That sexuality is only binary, a man and a woman, right? Anything other than that is considered to be a sin or considered to be not social, antisocial. All of that.
Being a woman is also considered a sin to some extent.
I mean, we can definitely have a different podcast altogether to talk about it.
Especially being a woman from a marginalized community. Like we were talking about, if someone sharing my space, someone from my financial background, someone who is as educated as I am, who has a more or less similar social standing to me. If we are in need of need of mental health care, so we won't be facing violence of any kind. We will be ostracized. We will be insulted. We will be discouraged. But physical violence nahi hoga mere saath. But there is a certain social identity, like caste, for example, which it makes a difference. These when a Dalit woman might act might visibly be suffering from a mental disorder. She might be called a witch, and she might be harmed physically. वो मेरे स्पेस में किसी वुमन के साथ नहीं होगा. वो मेरे कास्ट के किसी वुमन के साथ नहीं होगा. A specific, a particular social group will have different. Society will react differently to those people having mental disorders, especially clinical mental disorders.
I'm not really sure if I would be the right person to respond to this, but essentially, I don't really think it would be the case. So as I said, one, of course, there is a caste impact or a social, yes, caste impact on everything that we go through. Having said that, there are issues which are similar in every caste as well. So, for example, a subject like homosexuality, a subject like mental health is still considered as a taboo, irrespective whether you are from different any caste for that matter. So, it's going to be the subject is extremely stigmatized. So, irrespective of whichever caste you come from, is what I think. I may be totally wrong about it.
Yeah,
However.
yeah. Yeah,
But I
I'm not saying that the oppressor caste, the Brahmins, etc., don't face stigma when it comes to mental health care. I'm not saying that. I'm just saying they are in an environment which enables people around them to react like that.
Yeah.
Like I said, I can't give a starker example than this. Yeah, these things won't happen with me. If I go out and act in a way which makes people think that I'm crazy or I'm insane, I might be institutionalized, there might be some physical restraint on me, but I'm not going to get beaten up, I'm not going to get killed. So
yeah,
so
okay,
that
you're right.
Yeah. So
right, that difference definitely exists. I mean, I would say that also in terms of the accessibility, right? Of course, the upper caste is definitely do have easy access to mental health care, and therefore all the Dalits or the Ati Dalits and the marginalized are definitely having a complex challenge in itself to have to get accessibility, irrespective of whether mental health as a subject itself is stigmatized or no. But our lived experiences definitely is different for a Dalit woman or a queer Dalit woman or a Muslim Dalit woman. Well, that's a different subject, but a Muslim queer person, right? So all of this would have a different challenge when it comes to accessibility. And that's where the intersectionality of the problem kicks in, that how you and me respond to a problem, or what is our experience with a problem versus a person who is at the intersection of multiple identities. So, yes. So coming back to the question whether whether you will have to face violence because of your mental health, I'm sure you know your reality better, but coming back to remember the example that I spoke about, a student who in Goa who was taken for conversion therapy for a sexuality.
Yeah, you're right. But then you're right. But then the difference being for someone from the oppressed caste or from a low-income group, the society, the people around them are the ones enacting the violence. And यहाँ पे it's the violence is coming from the therapist. I don't know, not a therapist. Whoever did that should not be called a therapist. but
they were not a therapist. They were a doctor. They were a doctor. They were psychiatrists. Doctor.
They shouldn't be called a doctor either.
Exactly. And there was a huge protest, and there were a lot of protest which was done.
These protests won't happen in a community like that, where the entire community has decided that this woman is a witch or this man has been possessed by a demon. They are going to be physically violent. He or she is either going to be an outcast or they are going to be killed. Who is going to protest? The village killed them.
Yeah, you're right. Yeah, you're right. And that's the difference between the.
It's ridiculous.
Yeah, I can understand. I mean, it sounds absurd, but that's the reality. You're right. If it's a remote rural setting, and you have a person who's having a maniac episode, or a or is suffering, does have psychosis and things like that, the entire community is going to ostracize that particular person. But is there a presence of violence? Of course, there is a presence of violence, I'm sure. So let me share one of my own experience. So sometime around 2004 or so, I visited a temple in Kerala. It's called the Bhagavati Amman temple. So if you just visit that temple, there are teenagers, young women, young men, and all of them tied to trees with big metal chains. Okay, tied to their feet, because all of them had these maniac psychosis kind of an episode. So and it's still there. It's called the Bhagavati Amman temple in Kerala. So I'm saying that the entire community, the entire rural setting is going to ostracize them, and there is presence of violence, definitely. I mean, you can't really say that there is no violence there, but there is violence across. In fact, the violence is definitely coming. The violence is committed more by people around them, the family members, more than the community first. There is violence.